Let me ask you guys that you probably are here the ones that are treating osteoid osteoma more often. Are you happy with the MR-guided focused ultrasound therapy?
Yes.
Yes. Okay,
Yeah,
fantastic.
I think so.
What's next? Where do you see future of this technology? Let's take advantage of the presence of you here.
I think there's really an opportunity to expand for additional benign painful lesions that come across. So we see patients with eosinophilic granulomas. There's a whole range of benign bone tumors that also cause pain that patients are seeking out non-invasive treatment options for. And I think that's sort of the next frontier. They're not quite as classically presenting always as osteoid osteoma, which I think makes it difficult to group them together and do formal studies. But I think that's
for example, in L'Aquila, what you're saying, they already started in doing that.
Yeah, that's right. So I think it's really important that we...
About malignant lesions, are we ready to push to there? Peji, what do you think?
I'll put in a plug for Karuna, who should probably be up here as well. I think one of the exciting areas to explore is a study these guys have been pushing for a while to deliver drugs using focused ultrasound to malignancies, to sarcomas. And I think that's an exciting new application and an exciting area to explore with focused ultrasound. The benign entities, painful entities, I think we have a good grasp on, actually. And I think outside the United States in particular, they've expanded to include, I don't know, ABCs and other types of bone lesions and osteoarthritis as well, facets, obviously we know about. But I think that the sarcomas in particular, are, in terms of kind of the crystal ball, I think it's an area to really explore and push forward towards. Not all oncologists, I think, are as ready as perhaps the team at Children's National to pursue this, but I think the data that these guys derive will help drive the field in that direction. I think it's a real opportunity.
Great. Do you have a question?
Yeah, so for someone who's working in MR thermometry, I was wondering how important to you is it to have temperature data of your bone? And if it's not important, that's a good answer as well.
No, I think from our experience, it's extremely important, both for safety, being able to run thermometry at the surface of the skin. But for younger patients, I don't know about you, but we actually get a good temperature signal in their bone itself. Their marrow is still, it's a different consistency than older patients, and we get a lot more temperature mapping information from within the bone, not the cortical bone, than we do with older kids.
We all like to have the signal in the bone for temperature, very much.
There's an opportunity here to also just slightly expand the array of coils that we use with these clinical systems. So, you know, if we used something like a medium-sized loop coil, we could get much better signal in extremities, and that's, you know, if enabled for clinical trials, that could be a big step forward to getting much better data of the sort you're describing. But,
okay.
There's two scenarios where I found that you don't need the thermometry, and it's not by desire. It's just it's happened. You know, if the patient is very cachectic and there's no soft tissue, no muscle next to the bone, and all you have is fat, you're not going to have necessarily anything to give you any signal. In those cases, you can treat, not blindly, but you can align your system using whatever muscle there is to know that the targeting is accurate, and you know where your tumor is, and you can just aim. It will work in that case. And we've also treated a patient that had a large metal implant around a metastasis as well. And obviously the thermometry there is completely destroyed by artifact. But again, knowing that the system was aligned at an area that lacked artifact, and then going to the area where the tumor was and treating, again, it works. But those are not desirable. In every other case, I'd much rather know where the heating is happening and that it's safe and effective. The thermometry gives you that information.